Hello everyone, this is Dr. Aman Upagan Lavar, Associate Professor, Department of Pharmacology, SNJB, SCTJ College of Pharmacy, Sanwad, Nashik, India. Today I am going to discuss about this research topic, that is virgin coconut oil solubilized curcumin protects diabetic nephropathy in rats. So as per the International Diabetic Federation, up to 2030, worldwide, there will be 578 million people who will be suffered from the diabetic. And apart from that, 30 to 40% of patients having the diabetic mellitus, they may develop secondary complications of the diabetic. And one of that complication is diabetic nephropathy. Several pathways are involved in the pathogenesis of diabetic nephropathy, but oxidative stress plays an important role in diabetic nephropathy. Many researchers shows that how oxidative stress involved in the diabetic nephropathy, and many natural products, they're having a strong antioxidant activity, and they will be used as a promising alternative for the prevention of diabetic nephropathy. In the present work, we use virgin coconut oil and curcumin. Both these the natural product, and both they are edible material, and they are used as a good antioxidants, and they also produces the synergistic property. Considering the fact, the objective of this work was to develop streptozotocin induced animal model of nephropathy, to study the role of antioxidant and oxidative stress in the pathogenesis of diabetic nephropathy, then to check the effect of virgin coconut oil and curcumin alone and in combination in diabetic nephropathy and their effect on different parameters. For this study, the study protocol was approved from the Animal Ethical Committee, Institutional Animal Ethical Committee of the institution. Curcumin was obtained as a material, it is procured from the coumarin flux and the purified form. Then virgin coconut oil was freshly prepared at the time of the experimentation using the hot maceration process. In the experiment, we used the male albino rat for the experiments. The animals were grouped into following group, and each group containing 6 animals as per the statistical requirement. Group 1 considered as a control group, and they were injected with the citrate buffer, which was the vehicle for the streptozotocin. Group 2, streptozotocin was given intraperitoneally at a dose of 60 mg per kg once. Group 3, the diabetic nephropathy animal, they were treated with virgin coconut oil. Then group 4, that virgin coconut oil plus curcumin at low doses, and group 5, virgin coconut oil and curcumin at high doses were given. The dose of this virgin coconut oil and curcumin, the curcumin dose was selected based on the solubility of curcumin in a fixed volume of virgin coconut oil. This is the experimental design. The animal were injected with streptozotocin. After 72 hours, the blood glucose level was checked. Animal whose blood glucose level was found to be more than 250 mg per deciliter were considered as a diabetic, and then that animals were allowed for 4 weeks for the development of nephropathy, and this nephropathy were assessed by glucose as well as the protein in the urine. After 4 weeks, it was observed that the animals having the significant nephropathy, then they were grouped into the 5 group as shown in the previous slides. Then the treatment was started and it was continued for 4 weeks. At the end of 4 weeks, the biochemical parameters were assessed and markers of oxidative stress were also tested. In that, superoxide dismutase, glutathione reductase, catalase, and lipid peroxidase, along with the membrane-bound ATPases were also evaluated. The effect of virgin coconut oil and curcumin on the general parameter like body weight, feed intake, and water intake was observed. It was observed that in diabetic nephropathic animal, the body weight was found to be significantly reduced, feed intake was significantly increased, and water intake was also significantly increased. So curcumin plus virgin coconut oil at lower dose and the higher dose, they significantly alters or improves the altered body weight, feed intake, and water intake as compared to the diabetic nephropathic animal. The statistics which applied using the graph-pad prism and the Dunnett t-test was performed, and p-value less than 0.05 is considered as a value for significance. These are the urine parameters. In that, total protein, creatinine, albumin, uric acid, and urea were checked. It was observed that in diabetic nephropathic group, the total protein was significantly increases, creatinine was significantly decreases, albumin was significantly increases, uric acid was decreases, and urea was also decreases. So the treatment with curcumin and this virgin coconut oil showed a highly significant recovery in all the parameter as compared to the disease control group. These are the biochemical parameters which are performed in the serum. Under that, you can observe the glucose level. It was significantly increased in the nephropathic animal, and it was very significantly reduced when the high dose of curcumin in virgin coconut oil was given to the animal. Similarly, total protein was reduced in the nephropathic animal. Creatinine was also increases. Uric acid was increases. Urea was also increases. All the parameters were significantly restored by the high dose of curcumin and this virgin coconut oil. Endogenous antioxidant plays a very important role for of scavenging the free radicals. Whenever there is a bombardment of free radical more than the capacity of endogenous antioxidant, there is a generation of oxidative stress. So we have checked the level of catalase, GSH, SOD, lipid peroxidation in the kidney homogenate of the rat. And here we have observed that in case of this diabetic nephropathic animal, the catalase activity was reduced, then GSH activity was also increased, SOD and activity was decreases, and lipid peroxidation, it was slightly increases. But here throughout the study, we have observed that there is no significant changes observed in case of the catalase level, whereas GSH was significantly restored, SOD was significantly restored, and the lipid peroxidation was also significantly restored. So overall, this indicates that the combination shows a good antioxidant activity than the alone. This membrane bound ATPases, it was also checked in the residues which was remain after the use of the homogenate from a kidney section. In that, you can observe the level of sodium potassium ATPases, calcium ATPases, and magnesium ATPases. All are significantly increases in case of the diabetic nephropathic group, whereas treatment with high dose and low dose both shows a significant recovery in the membrane bound phosphatase level. So overall, the conclusion of this study is that oxidative stress plays an important role in the pathophysiology of diabetes and nephropathy. Treatment with virgin coconut oil and curcumin protect diabetic nephropathy induced by streptozotocin experimental rats. The combination shows better activity and dose-dependent activity than the alone, and the effect might be due to strong antioxidant activity of both the compounds. These are few references of the study, and I heartily thankful to Academy of Excellence in Biosciences for supporting the registration part of the conference. Thank you once again.